Hello, my name is Eric Prosher, and you are watching a live call-in interactive program brought to you by CAN TV 21. Today, I'm from Jesse Brown VA Medical Center, and we have a special guest from our medical center. This is Dr. Caitlin Lee Stroh, and over the next 25 minutes, we're going to be talking about a new program at Jesse Brown, or it's not necessarily new, but a program that has been evolving over the years. It's called PCMHI, which is Primary Care Mental Health Integration. So call in with your questions and stay tuned. Hello, Dr. Listro.
Hi.
How's it going?
Not bad. Thanks for having me.
Thank you for giving us some of your time. I know you're really busy. Why don't you tell us a little bit about yourself, how you got to VA and what your role at Jesse Brown VA Medical Center, and then we'll go from there.
All right, sounds good. So I actually got into VA. I did one of my clinical practica at the Ann Arbor VA in their substance use clinic during my last year of grad school. Really liked working in the VA setting, so I went there for my internship, which for psychology is sort of like a mini residency, and then postdoc in the Memphis VA. And now I have finally returned to Chicago, which is my hometown, for the PCMHI department. And I'm actually specifically working in PCMHI for the Transition and Care Management program, which serves post 9/11 veterans.
That's right. And we actually work together. I'm also in the clinic. It's a post-deployment clinic serving veterans that have served in combat areas after 9/11. And we have a special clinic at Jesse Brown VA because we have primary care, we have social work case management services, and we have mental health all co-located together. And so why don't we start off by kind of defining what PCMHI, Primary Care Mental Health Integration, what is that? What does that mean?
So we love our acronyms. So
That's right.
PCMHI, Primary Care Mental Health Integration, is really meant to be that. A collaboration between your primary care services, which is your general doctors, the ones you go to get your medical care, as well as mental health services. In a traditional model, they're very separate. You go see your doctor, if you're having a headache or something like that. If you're, feeling depressed, you go see a therapist. But often what happens is that most people go to their primary care doctor. Not a lot of people make it to a specialty mental health service.
I'm glad you said that because when I came to Jesse Brown in 2006, my job was I was returning education and outreach psychologist for the post 9/11 veterans, and our job was to kind of engage these newer veterans. And one of the things I discovered is that the veterans, oftentimes I would see that they had a primary care appointment in the hospital the same day that their mental health appointment was, but they wouldn't follow up they would attend one appointment and not the other appointment. And that's kind of the idea behind the post-deployment clinic. Well, let's all get them all together in one location so it's not as easy to miss appointments and stuff like that. Is that so? My guess is that's one of the ideas behind the PCMHI, strike while the iron's hot, right? Because the longer it takes for the person to get an appointment after they have engaged with their primary care person, the lower the probability is that they will actually follow up with the mental health referral.
Exactly, because this is often you're being referred to someone that you've never met before. Maybe the appointment is in a week or several weeks, and often at that point people are starting to get a little nervous, or things are coming up. So the PCMHI model is intended to be able to meet with those veterans same day. So if someone comes into their primary care appointment with their doctor, the role there for the primary care doctor and the nurses is to do some screening, to assess for mental health symptoms, but also what we call behavioral health. So things like sleep, issues, having trouble quitting smoking, having trouble losing weight or managing your diabetes medication or adjusting to a chronic illness. Things that, you know, you don't necessarily think of as mental health, but that really affect your quality of life. And so if a patient brings up some of those concerns with their primary care doctor, then their primary care doctor can bring them right after their appointment to a PCMHI psychologist or social worker who can do a brief assessment with them, see what's going on, and create some kind of treatment plan, all in that same day.
Wow, so it is literally one-stop shop.
Exactly.
So you go, you see your primary care physician, and is this something that the primary care provider would suggest, or is this, or could the patient or the veteran themselves say, hey, I want to talk to somebody? How does that work?
So either way, so sometimes the primary care physician will say, hey, you know, it sounds like you're having some trouble with this. Would you like to talk to someone? But I have also had patients who have come into their doctors and said, you know, I really need to talk to someone. I want to engage with mental health. I'm having troubles in this area. And that's another route for them to get connected as well.
Okay. So one of the things I noticed is that, as you were saying, there's a whole range of kind of issues and concerns that can be addressed right there in a brief kind of fashion within a few sessions. And that there was a bunch of other programs that were being offered. I think that's is unique, especially considering the post 9/11 veterans. A lot of them are new parents and are in relationships or are working, and it's complicated lives that they live. And I've seen programs like parenting, education, and interventions to help with managing difficult child problems, I think. Is that the way you would say it?
Yep, exactly.
And I've seen groups that you've done for sleep. I've actually you've helped a couple of my vets with that, get a handle on sleep, which is like one of the most common problems that our post 9/11 veterans have when they return. There's also
would you like me to tell you more?
yeah, what else is there?
While you're trying to figure it
I'm trying to
out?
remember all the things I've seen, but you know.
Because we have a lot of different services.
Okay,
So first of all, I want to say we've been
tell us
talking a
more
lot.
tell us
Yeah.
about the services. I'm sorry. and
Yeah,
then
because
we'll
we've been talking a lot about post 9/11, but I do want to clarify that we have PCMHI services for anyone who's in primary care, regardless of age or service era. However, we also have specialty kind of mini PCMHI teams for the post-appointment clinic and for women's clinic.
Okay, so it's not just you. There's a
It's
whole
not just
bunch
me.
of you, and it's a big hospital. You guys are spread throughout the hospital,
Exactly.
working as a team to address these issues in primary care settings all throughout the hospital.
Exactly.
Okay, great.
And so Eric already mentioned that we have both individual and group parenting classes in education. We have the sleep group. We have another group focusing on relaxation and stress management. We have a new group focusing on changing your substance use. So for people who maybe aren't interested yet in doing a full program, or maybe never want to do a full program, but would like to do some brief work on reducing some of their substance use. We're starting a new effective communication group for people who want to learn assertiveness and conflict management skills. And then we have a grief group for people struggling with grief and loss, and a healthy aging group for older veterans who are struggling with some of the symptoms of aging and would like some support and help with that. As well as we also offer individual services for most issues. So the idea being that not everyone wants or needs to go through long-term therapy in a specialty clinic. So we can offer 1 to 6 brief sessions in PCMHI where you can focus on learning skills to help manage whatever issue you're dealing with. And for many people, that's often enough to help to keep the problem from getting to the more severe level where they would need specialty mental health care. For other people, maybe that's a great start and they decide they want to continue doing work, and then that's a referral we can make as well.
That really makes sense, you know, especially being aware of some of the psychotherapy efficacy and effectiveness research, and that first of all, the most highest modal number of sessions that anyone attends treatment is 1, right?
Right.
And that's where a lot of benefits happen after the first session. But after that, the next dramatic decrease or improvement in decrease in symptoms, improvement in functioning is at 6 sessions, you know?
Yep.
And then after that, it jumps to 6 months.
It's almost like someone did some research about it.
So the 6th session is, yes, it's an evidence-based model, would we say? That's the new buzzword?
Evidence-based.
That's the new buzzword. So, and also, I know I'm a psychologist too, and I work in the PTSD clinic, and sometimes a lot of my veterans complain that, wow, they had to go and see somebody, get an evaluation, and then get referred to someone else to be able to be evaluated, only to get, by the time they get to me, I'm the 3rd person that they've seen, that they've been telling the story to, and that can be frustrating for a lot of people as well.
Yep, and that's the nice thing is that, for many people, they can stay with us for at least a few sessions, and, especially for someone who's never done therapy before, has no idea what it looks like, that can be a great way to get started with it.
Yes. So, what do our audience need to know about PCMHI in terms of Jesse Brown? How do they get involved? Who are the contact people? Is there a number that they could, someone could call if they had questions and more information about those services? So
our PCMHI coordinator is Dr. Julia Kogan. She's located in primary care. And basically, whenever you see your primary care doctor, if you have questions, if you want to know, is this something that I could get help with, just let them know that you want to talk to a PCMHI provider. And someone is always on call every single day of the week. All of the primary care doctors have that number, so they'll be able to reach out, and someone should usually be able to see you within no later than half an hour from when they receive the call.
That's great. So this is Jesse Brown VA Medical Center, which is located at 820 South Damon Avenue in Chicago. We also have community-based outpatient clinics in the Loop, in Chicago Heights, in Northern Indiana, and then Auburn Gresham neighborhood. Now, is there a PCMHI in our C box as well?
So it depends on the particular CBOC. We're working now to establish more consistent and comprehensive PCMHI services at the CBOCs. However, if you have questions about that, please ask your primary care doctors, because they can always reach out to us at the main hospital for help with, getting you connected.
Great. Would you like to say something about the pyramid here?
Yep.
So for those of you at home, we have
Pyramid's falling.
a fallen pyramid. Okay.
All right, so this is really the idea of how PCMHI is supposed to work. So down here you have primary care, your general physicians and nurses who are screening for mental health conditions, maybe starting some kind of medication if appropriate. And if they notice any kind of problems, then they can refer to the PCMHI provider. And they're going to do more intense evaluation and potentially treatment for, mild to moderate mental health issues. Things like depression, substance use, anxiety, even PTSD. Or like I said, behavioral health issues like losing weight, quitting smoking, stress, relationship problems, things like that. PCMHI can also get you connected with a medication provider if you haven't been on medication before. However, for some people, like I said, they get their treatment in PCMHI and then they're doing okay, so they, move back to primary care until potentially in the future they would like help or support again. For some people, the issues that they have might be a little more severe or, might require some more long-term work. And so in that case, we can refer them to the appropriate provider in a specialty mental health clinic where they're getting more long-term treatment along the lines of 12 weeks or more.
All right, and for those of you that may have just joined us, we have Dr. Caitlin Lee Stroh, who is our primary care integration psychologist at Jesse Brown VA Medical Center's Transition Care Management Clinic. but we're talking about how mental health services have been integrated into primary care across our VA hospital. And so, Dr. Lee Stroh, now we've reached a segment of the show which we call Rapid Fire. And in this segment of the show, I have a series of questions that I ask you. It's a free
dear.
association. You share your first answer that comes to your mind. Some
Okay.
of these questions are related to maybe your job. Others are related to get us help us get to know you a little better, a little bit better. Okay, so are you ready?
I am ready.
All right. So, what is your favorite guilty pleasure? Food pleasure.
Oh, guilty food pleasure?
Yes.
Ooh, probably pizza or Indian food.
Pizza, Indian food. All right, all right. Next one. What's the worst job you've ever had?
Ooh, the worst job I've ever had. Probably babysitting. Not really my thing.
Babysitting's not your thing?
It's the reason I didn't go into child psychology.
Okay. I know, I had a brief stint there and I had to leave myself. So, given the choice of anyone in the world whom you would want as a dinner guest to share a healthy meal, what would that be?
Any living person?
Living or dead or deceased?
Ooh. I mean, I'm a huge book nerd, so I would love to have dinner with Stephen King.
Stephen King. All right.
Fascinating man.
All right. What's your favorite Stephen King book?
You know, I really liked Dreamcatcher.
Dreamcatcher? Okay. Okay. And what is your favorite healthy food dish?
Favorite healthy food is, I don't know, I really just like carrots, like basic baby carrots. They're a
Baby
good
carrots?
snack.
Okay. And name 3 things you and your veteran patients have in common.
Have in common. Ooh. Like in general?
Anything.
I guess, you know, many of us have grown up in the Chicago area.
Okay.
I will say I have in common.
You're a local Chicago.
I am. I have in common with about half of them that I'm a Sox fan. You know, the other ones we agree to disagree.
Okay. Wow, because you get more Cubs than Sox.
I know, it's a little tough.
Yes.
And I guess many of us were born in the 90s.
Okay. Very nice. And before talking to potential patients, do you ever rehearse what you're going to say?
Typically, if I'm doing kind of a new therapy, I'll do that because there are usually specific things that you're supposed to go over that I don't want to forget. But after a while, once I have my own way of saying things, I don't really need to do that anymore.
Okay. And for what in life are you most grateful for?
I would say my family. I've been lucky to be very close to them. I, you know, live physically close to them again, so lucky that they're still around.
Okay. And if you could wake up tomorrow having added one superhero power, what would it be?
Definitely telekinesis.
Telekinesis?
I would love to say it's not out of laziness because I could, you know, grab objects, but that would definitely be super useful.
Very nice, telekinesis. So, if there was is there something that you've dreamed of doing for a long time but haven't done yet?
So someday I would love to publish a novel.
Ooh. And you're working on some novels now?
I am, yeah.
Very nice. And what's the theme?
So the main projects I'm working right now are both young adult, so teen fantasy.
What do you value most in friendship?
I would say that I value openness.
Openness? Very nice. And last but not least, if you had a crystal ball that could tell you the truth about your health and future, what would you want to know?
Yes, I would just want to know, you know, what's the most important thing that I need to pay attention to, you know, continue to grow and improve as a person.
What a great answer. Well,
Such a psychologist answer, I know.
well, mission accomplished. We finished the rapid fire. I really appreciate you coming in, giving us your time, sharing us your wisdom and information about your role and the role of PCMHI at Jesse Brown VA. For those at home that are interested in finding out more information about PCMHI, You can always check out our Facebook at www.facebook.com/Chicago VA. And for those of you that need to speak with someone and want to know more about services at Jesse Brown, it's 312-569-VETS, VETS. And I'm Eric Prosher. This is Caitlin Lee Stroh. And we're from Jesse Brown. Thank you for joining us. And we're going to be next month, fourth Thursday of the month, Veterans Issues. We'll be back again talking about, next month will be suicide. Thank you and goodbye for now.
All right, thank you.